Hello students, now we are coming to the last valve disease, that is the tricuspid valve disease. Now the tricuspid valve is a valve that is present between the right atrium and the right ventricle. So this is supposed to be effectively pumping blood or sending in blood from the right atrium into the right ventricle. Now if this does not happen effectively, so there could be some kind of valve disease again, which could be the narrowing or obstruction of the valve, which is called as stenosis, and there could also be a regurgitation, which is nothing but a valve there could be a prolapse of the valve, or there could be a weakness or a floppiness in the valve, and due to some kind of disease and various etiological factors, and this could lead to this particular condition called as the tricuspid. Now this picture clearly defines what is the stenosis and regurgitated valve. So you see in this first picture here the tricuspid valve, and when you know that it is stenosis, it is supposed to be in the normal heart. You can see that how much of blood actually is meant to be flowing from the right atrium into this right ventricle in a normal phase, but again in a stenotic valve you can see how it really only drips. So this means again what is going to happen, there is going to be a lot of pressure that is built up in the right atrium. There is going to be putting a lot of pressure on the right side of the body of the patient, and there is going to be distension, cyanosis, edematous condition and all that, and also increased increased pressure. Now, and the similar way, when you know that there is a regurgitation, means what? Again, the valves are floppy or saggy, and it is very weak. So what happens, it is not in a position to control the flow of blood. Okay, so what happens, there could be blood flowing back into the chamber and again back into the ventricle as well. So there's going to be improper blood flow that is happening from the atrium into the ventricle. And also, now tricuspid atresia, I think I mentioned this in the beginning as well. So atresia, it looks like it's a hard solid sheet like a flap completely. So a tissue that blocks the blood from flowing into the right atrium into the right ventricle. So what happens here is that there is absolutely no blood reaching into the right ventricle. So this again could be some kind of congenital defect that happens during birth, and for some reason there is this occurs in when you see when the child is born, and this puts a lot of pressure, because again that you will see that the person is going to be cyanotic or it's going to be bluish, and again there's no proper or absolutely no blood actually going into the lungs for. So this is a tricuspid atresia. Now Epstein's anomaly is another condition. So what you see here is the valve, one of the flaps you can see here is actually positioned quite low. Okay, it is supposed to be higher above, that is the right atrium and then the right ventricle, but for some reason even during the developmental phase, and again this is called as a congenital defect, for some reason the baby born will be having a heart like this, which means the one of the flaps of the valve is like way below, okay, quite low. If you look into the picture here, it's very clear, because the picture shows here a healthy heart and a Epstein's anomaly heart. Okay, so this is what happens. Again, what happens is there is not going to be effective closure of the valves, and also what happens, blood is just going to be flowing from the atrium into the ventricle, and again from the ventricle where it's supposed to be only effectively flowing into the pulmonary artery, what happens, that blood is also going to be flowing back into the right atrium. So this is the anomaly, and this is again the disease of the tricuspid valve. Again, the etiology or the causative factors for this could be, yes, there could be some kind of a valve lesion, and the research or studies have shown that it is more common in the females, okay, than in males. And rheumatic heart disease, yes, it could be one of the most important factors or causes, and most frequently this is associated with mitral and aortic valve disease also. Okay, and also you will see the carcinoid syndrome, and which is nothing but the tumor, something kind of a cancerous or a tumor or a growth that is seen, and this could also be the cause of this tricuspid stenosis. Now pathophysiology, again, what happens here, you know that I showed you the picture, so you know that there's going to be stenosis or regurgitation, and again definitely what is going to happen, yes, whatever blood that is supposed to be coming out of the aorta, yes, it's diminished, so there is decreased cardiac output, and as I showed you in the picture here, there is going to be a lot of congestion on the right side, which means, and to be very precise, there's going to be fluid overload in the right atrium, increasing right atrial pressure, and there is going to be a complete venous congestion and venous hypertension, and this produces, again, as I told you, there's going to be edema on on the right side of the heart, and this shows up as the signs and symptoms where the patient exhibits edematous ankles and swollen ankles, hepatomegaly, ascites, again there is fluid buildup in the abdomen, and this is what other experience. And definitely along with that, as you know, there would be the signs and symptoms will also include like a murmur especially when you listen to the patient's chest, and yes, edematous conditions, and difficulty in breathing, abdominal pain or swelling. That is, you will see this when you do the physical examination, and obviously yes, fatigue, weakness, lethargy, again it's all due to the decreased cardiac. Investigations for this will include again thorough history collection, physical examination followed by chest x-ray, ECG, or infections of the different lining of the heart, and yes, the patient will be experiencing palpitations. So antiarrhythmics will also be playing an important role, and yes, to take care of your edematous condition, the patient is going to be on diuretics, or for example, the most common one is furosemide or Lasix, and along with insisting the patient and the family about a salt restriction. The surgical management, as I told you, will be tricuspid valve replacement, and definitely when you're on this, you will be on warfarin. So this is nothing but you're trying to avoid the clot or the thrombus formation, because you know that that's going to be a foreign body in the patient's heart. And again, when you have the prosthetic valve, very important that you're going to be on anti-thrombotic treatment, or rather anticoagulants, and also the percutaneous balloon. So tricuspid valve regurgitation, again, this is what we're going to be learning here now. This picture again clearly defines what it is. So a normal heart, what it looks like, and a regurgitated heart. Again, you will see that the arrow shows that from the right ventricle, the blood is going back to the atrium. So which means that the valve is not functioning effectively. The causes for this, again, it could be Epstein's anomaly, which I showed you in the beginning. It's nothing but a congenital disorder where one of the flaps of the valve will be like way below, and it is not in line. So what happens? The valves are not closing effectively. Also a condition of infective endocarditis, which is nothing but infection of the inner lining of the heart. Carcinoid syndrome. Also implantable devices, especially when a patient is having these arrhythmias. Again, maybe the patient is some kind of leads, like a pacemaker lead put in. Again, this could also sometimes interrupt and cause this kind of problems. Trauma to the heart can also be the reason for this. Rheumatic fever, congenital heart disease. Marfan syndrome, again, it's a kind of a genetic disorder where you see that abnormal proportions in the body structure of the person, and also excessive radiation. The pathophysiology will be due to all these etiological factors. You know that yes, the person could be having this mitral stenosis and regurgitation, and the causes may be various. So it could be cardiomyopathy, coronary artery disease, mitral valve disease, or even the pulmonary valve disease. So all this can contribute to this particular disease condition, and due to all this, you know that yes, there's going to be increased fluid volume overload in the right atrium, producing a lot of congestion and increased pressure or tension in the chamber, and putting a lot of pressure on the right side of the heart. And so there's going to be increased jugular distension, jugular vein distension, and also you will see that the person is going to be experiencing atrial fibrillation, which is nothing but the arrhythmias. And also, again, as I told you, due to this regurgitation as well, what's going to happen again, it's going to be putting a lot of pressure on the atrium, and also it's going to be causing pressure on the pulmonary side as well, because here the valve is not really closing effectively. So there's going to be completely volume overload in the right ventricle. Again, it's just trying to push blood back into the pulmonary artery, and that's going to put a pressure on the pulmonary system. So pulmonary hypertension is going to be visible. Eventually, what is going to happen is the right side of the or rather the right atrium is going to be experiencing this weakness, or the right side of the heart is going to be experiencing this weakness. And yes, definitely the ultimate problem will be, yes, the person is not receiving or there will be decreased cardiac. Clinical manifestations of this will include fatigue, due to this excessive weakness and tiredness. Yes, the person is not going to be performing as normal activity, so there's going to be activity intolerance or lack of physical activity. Swelling in the abdomen, neck, legs, veins in the neck. Abnormal heart rhythms are nothing but palpitations, and also there is be pulsing in the neck or thumping pulse in the neck, because again this is going to be due to the excessive congestion that is happening in the right atrium, putting a lot of pressure on the in the jugular vein as well. And yes, very important signs and symptoms will be difficulty in breathing or dyspnea, and also there could be cyanosis as well, because again, as you told, that as we see that yes, not much blood is actually pumping out of the heart, where the body actually requires to be performing its normal activities. The risk factors will include infections, a heart attack, heart failure, pulmonary hypertension, which is nothing but increased pressure in the pulmonary system, the heart disease, any sort of heart disease, congenital heart diseases, and also when, as I've always mentioned, when you're on long-term medication, so that also plays an important role in affecting the heart, and also radiation exposure to X-rays for a long. Complications will include yes, heart failure. This occurs when the heart is weakened and the heart is working overworked, and eventually becomes weak, and finally was not in a position to pump effectively, and the person is going to be also experiencing this. Diagnosis will include again physical examination, thorough history collection, ECG, echocardiogram, transesophageal echocardiogram, again, which is nothing like a probe which is inserted through the mouth and through the esophagus, and again you're going to be doing this echocardiogram, cardiac MRI, chest X-ray, exercise stress test, again to know how much the heart is able to actually take the activity basis, and also can be ruled out by doing a proper diagnosis, which is nothing but the where the patient is sent into the cardiac cath lab and doing the angiogram. Medical management will include diuretics, antibiotics, antiarrhythmics. So this is a list of antiarrhythmics that we normally prescribe for the patient, which is amiodarone, or also called as cordrone, flecainide, or another way, another name to it is Tamacor, lidocaine, procainamide, quinidine, and also tocainide. Okay, so this is the kind of antiarrhythmics that we administer to the patients. Not all of them, but again, depending upon what suits the patient best, the cardiologist will be prescribing that to the patient. Surgical management will include heart valve repair, and if that doesn't happen, then yes, the only choice is heart valve replacement. Again, nothing but a biological or a tissue valve is going to be put in, or nothing but the biological valve or the mechanical valves, and also the valvuloplasty, nothing but using a catheter in a procedure. But when you know that how the valves are floppy, so you know that whatever excess is going to be removed, and then it is going to be put in position, or the only choice is putting a prosthesis in there, like a surgical procedure. And again, the person is going to be definitely on thrombosis treatment or anticoagulants, which is very, very crucial, because he needs to manage the condition where he will not be ending up with clots. Nursing management or nursing diagnosis includes impaired gas exchange, decreased cardiac output, activity intolerance, anxiety, imbalanced nutritional status, and also it will include the knowledge deficit, and regarding all the aspects which is about his lifestyle, his medications, his diet, and also you know, his what is it, the ways and methods of taking his medications, and explaining all that to both the patient and the family is very, very important, so they really understand what is the need, or they shouldn't be skipping these anticoagulants and medications which are prescribed. So we do not want any more infections and any more clots that is going to be happening or occurring in the heart. Also emphasizing on the importance of coming back for a follow-up and making sure that they will be having their blood tests as well as an echocardiogram done. Then health education, or what you would educate the patients will be regarding their lifestyle habits, home remedies, eating a healthy diet, exercise, how to prevent infections. So rather educating the patient about, you know, trying to avoid going out in the weather conditions which will cause kind of infections, and also avoiding crowds, and making sure when a person is not well, so do not visit them. So it's all that we do not want any sort of cross infections happening, because the patient has already gone through all this a lot, so we do not want any more troubles with the heart. Follow-up sessions, taking medications, also getting support. So whenever you know that when a person is kind of going through this phase, it is always better to introduce the patient to that particular group of people, where there will be many patients who has had valve replacement. So obviously the hospital database will be having this, or this is called as a support system or a support group. So the patient and the family is going to be feeling quite anxious when a person is supposed to be having this procedure done, or when they know that the person is having this condition. So having them to talk to this group will actually relax them down and calm them down and give them some kind of positive hope yes, okay, doing this procedure is going to really help, and he's going to be come back and doing his normal activities, and without any kind of dependency. Okay, and so this is introducing the support group is also very important by the nurse, and also telling the patient about how he can stay, as because of this decreased cardiac output, the patient is going to be really experiencing these symptoms of lethargy and fatigue. But yes, there are ways to overcome. Now that he's had the replacement, the heart is going to be pumping and functioning effectively, so he can have that positive hope. And yes, with this, I think his lifestyle changes will be proceeding effectively, and also with the counseling that the nurse offers the patient and the family, the patient should be looking forward to performing his activities and moving on with a normal lifestyle. Yes, with that, I think we have completed the valvular heart disease. Thank you for your time.